Dr. Sarah Doyle is a specialist in public health medicine and has worked in communicable disease control in the Department of Public Health for the past 12 years. She is clinical lead of the COVID-19 contact management program since the establishment in March. So just bear with us a moment or two, please, while we bring in Dr. Sarah Doyle. Thank you for joining us.
Hello, thanks for that. Jean, I think that was?
That's me, yeah. Thanks for joining us whenever you're ready.
Okay, perfect, thanks. Okay, so first of all, just to say thank you for inviting me to speak today. Sorry, my apologies, I'll just put that on slideshow. Okay, so I've already been introduced and I'm here today in my capacity as clinical lead for the contact management program, which Jean has said was established in response to the COVID-19 pandemic in March this year. So just an outline to what I'm going to cover today. It will be a reasonably short talk. I'm going to just introduce you to the contact management program, outline the contact tracing process, giving you an overview of what we're now calling call 1, call 2 and call 3. They're the calls that cover the various aspects of contact tracing. Then a little piece about referring close contacts for testing and for active follow-up, and then what your role might be in the context of all of this and supporting us in our contact tracing efforts. So just an introduction to the contact management program, which, as I mentioned, is a new program within the HSE and forms part of the Test and Trace program. And I guess you're all familiar with colleagues in departments of public health throughout the country, and contact tracing, I suppose, is a core public health function, and that has been carried out by staff in departments of public health for, many notifiable infectious diseases for many years, and that is done under the 1981 infectious disease regulations under the medical officer of health function. And I suppose importantly around that is that it's done under legislation and is done for public health reasons, and therefore we are kind of dealing with and managing sort of unconsented data, so to speak. So there are various powers under the 1947 Act and the infectious disease regulations relating to that. So in March, and anticipating a significant increase in COVID-19 positive cases in Ireland, the need for an adaptable and scalable central contact tracing system to manage the COVID-19 cases and contacts in a streamlined way with departments of public health was recognised. I guess very, very quickly it became apparent that the capacity within departments of public health to manage contact tracing relating to COVID-19, would be overwhelmed very quickly. So it was established in March, and with a view to managing high volume and low complexity contact tracing, allowing departments of public health to focus on the more specialised and complex cases and settings. And I guess just to outline as well, I suppose in March, the programme was staffed by a lot of volunteers from the public sector, and also from academic departments, particularly academic departments of public health. And as you all know, things became a little bit quieter over the summer, and there were 9 contact tracing centres initially, and then we reduced down to 1 in Galway, and since the summer we have been building a more sustainable model. So the aim of the contact management programme is to notify results to people who are tested or a nominated person, and to identify and manage contacts of people with COVID-19. So then in terms of the purpose, it's to provide advice and also to rapidly identify and close down chains of transmission of COVID-19. As mentioned, it's to release time for public health departments to undertake the high value public health expert activity, including surveillance or enhanced surveillance and complex control activity or outbreak management or investigation within sort of highly complex settings or of, difficult or sensitive situations. Another purpose is to slow the progress of the COVID-19 epidemic in Ireland and to delay and lessen the impact on health services delivery capacity, and also to save lives through slowing the progress of COVID-19 in Ireland and through reducing transmission. So what does the contact tracing process involve? So it's been split out into what we're calling a call 1, call 2, call 3. And I guess the call 1 and the call 2 are to the case. And the reason they're split out is twofold. One is that call 1 is done by a clinician. And, it's more difficult to recruit clinicians, but also the little bit of time between the call 1 and 2 gives the person a little bit of time to reflect on their close contacts. So our laboratory systems now, through our laboratory systems, across all the acute hospitals, they now upload all their COVID-19 or their SARS-CoV-2 results to what is called our COVID Care Tracker. So the initial call 1 to the case is, in response to a positive result. It's about rapid notification and provision of advice to the case. So actually, as of yesterday, this is slightly out of date because we're saying by text if COVID is not detected. But actually, as of yesterday, we have started to send text messages to people with COVID-19 when it is detected. And this is with a view to ensuring that people are as informed as soon as we know that they have a positive test result, that we inform them by text message. So a lot of consideration went into that. We obviously do realise that, people might have some concerns about receiving text messages, but again, it was in terms of in public health terms, it was to get that message as early as possible. And there is a link to information on the website. And then that is still followed up by a clinician phone call if, in the situation of a positive result. So again, it is at the point of call 1 that a person is asked if they have the COVID Tracker app, and they're asked to share the details of that, and what are called the keys are downloaded at that point, and that will create an immediate notification to people whose phones were within 2 meters for more than 15 minutes. All those people who were in close contact of that case, they will receive the notification, within a couple of hours through the COVID Tracker app. So the call 2, as I say, takes place a short while later, and the purpose of call 2 is the rapid identification of contacts of confirmed cases, and that is done by a non-clinician. So then that creates a queue on the COVID Care Tracker or on the IT system of people who have been identified as close contacts. And again, looking at call 3 in terms of that's a phone call to close contacts, and that's to advise them on restricted movements and on environmental hygiene, hand hygiene, other kind of infection prevention control measures to reduce the spread of transmission. We also organise a test of close contacts. That's an initial test or what we call an ASAP test, and they also have a day 7 test that's 7 days after their date of last contact with the case. And there is also, there will also be the close contacts who've been identified through the app, and they receive the same phone call. The one thing is that we do know that it's an app notification, and sometimes people can be identified both through what we call the manual contact tracing and also the app contact tracing. So we would ask them about that. Have you already received a call? And then the contact 4 is, the follow-up or the daily active follow-up, and what that is a daily text message to each of the close contacts up until 14 days after their last contact. And the purpose of that is to remind them about restricting their movements and also to advise if they become symptomatic or if they develop symptoms within the 14 days to contact their GP for a test and to self-isolate. And as I mentioned, we organise the second test on day 7 since last contact. There's no need for a day 7 test if it's within 20, if they're previously positive or if they're within 24 hours of the initial test. Okay, so this might be a little bit of repetition, but just this is kind of an overview of the call 1 and call 2 and call 3. So again, that first call, it's in response to a positive test result. There is a clinical case interview with the person who is isolating at home. So it's when it's confirmed that person is contacted to inform them that they have tested positive for COVID-19. And as of yesterday, as I say, they will already have received a text message informing them and also with a link to information on the website. So during that call, the person is given their isolation advice. We collect surveillance information, for example, around occupation, ethnicity. If they're a healthcare worker, there might be more detailed information on wearing of protective equipment, PPE. We also trigger the COVID Tracker app. And we just ask people to reflect on the people they have been in close contact with during the infectious period. And again, that's 2 days before the date of onset of symptoms, if they have symptoms, or 24 hours before the test if somebody is asymptomatic. Regarding people who have repeat positive tests and who do not have symptoms, well, either actually if they have symptoms or if not, we do refer those people with those results to our colleagues in departments of public health to make a determination on whether this is actually a new infectious case or not. You can appreciate that in the very short term that's highly unlikely, and even within a few months we know that, you know, the likelihood is that we're still picking up dead RNA from the original sample, but you know, we do know that there have been a kind of very small number of reinfections. So just to be clear that we know that this is that there's a determination that it's a new infectious case. So at call 2, this is the time at which the contact identification is done. So there is a subsequent call to the case and we're asking them to identify their close contacts, again 48 hours before the day or date of first symptoms if they have symptoms, and if they're asymptomatic it's within the 24 hours before the sample was taken. And again, my apologies, that slide hasn't been updated. It's actually until 10 days. So basically people are infectious from the 48 hours before or the 24 hours before the date of test until 10 days after the onset of symptoms or the date of the test if asymptomatic. And then the contacting of close contacts, again, a call to the close contact to inform them, to advise them about the restriction of movement, to advise them that they will get the daily active follow-up text message every day, and also that they will have they will be referred for 2 tests. So referring close contacts for testing and for active follow-up. So we do know that close contacts are the people most likely to develop COVID-19 themselves, and we are referring all close contacts for testing. And just from our own data, what we're finding is that about 9% of close contacts overall are positive, about 5% of those who are asymptomatic, and about 20% of those who are symptomatic. The one thing that's really important to say is that even if they have a not detected test, that is not a reason that they are, you know, can discontinue restriction of movements. That's because the incubation period or the time to develop the disease can be up to 14 days. So the purpose of the test is to identify if somebody has become a positive case and to give them the advice and to kind of restart contact tracing. but unfortunately for people who get not detected test results, that does not release them from the need to restrict their movements. And then just also one further kind of outcome on the close contact outcomes, or the positivity. Household contacts, again, the most likely, they're about 15% of 15 or 16% of household contacts will become positive. So most people, as I said, will be referred for 2 tests. The first test is, at the time of the call, we organise that test. It usually happens, same day or day after. Although, some delays, at the moment with the increasing demand, but they may not need it if, the first test is positive, or if the second falls within 24 hours of the first test. The first test, as I say, usually within a day or 2, and then on day 7 since the date of last contact. And then the daily active follow-up, that's a daily text message until the 14th day after their last contact. So that's the full potential incubation period, reminding people about restricting their movements and asking them have they developed any symptoms. And it also gives the phone number for HSE Live for them to ring should they need to organise a test for developing symptoms. Obviously, they can also contact their GP. The other thing that's really important, it's important for everybody, and in particular for close contacts, if you develop symptoms, the need to self-isolate and seek a test. Okay, so how can triage nurses support contact tracing? And I'm sure that it is something, and particularly at the moment with cases rising and increasing identification of contacts. And as I said, because of all of that, the delays that have been introduced into the system, that it is something that you may be contacted about. And, I suppose, one of the most important things that can be done is to give advice and reassurance and reiterate the public health messages. So there are the public health messages that are specific for cases and contacts, and that relates to contact tracing. But I suppose, I'd like to take this opportunity to ask you to kind of reiterate the general public health messages around COVID-19 at every opportunity, because it's really important that all healthcare professionals are on board with that and supporting it, and again advocating people, reducing their social contacts, keeping their distance, the mask wearing, hand hygiene, all of those things, and again being particularly careful around those who are vulnerable. So I suppose, one of the things, acknowledging that the circumstances are stressful and that, delays are stressful, explaining that there may be some delays as the numbers are continuing to rise. And I alluded to this earlier, active recruitment is ongoing. The final model is anticipated to be 5 contact tracing centres throughout the country. Now, in some ways, that's sort of not that relevant because it's a national system, and so cases and contacts are picked up, by any of the contact tracing centres, regardless of where people live. Now, the referral then to local departments of public health is on a geographic basis. So I suppose that gives sort of the national, the overall national response, but then kind of a more localised, more detailed response locally as well for the higher complexity situations. There is a central management structure also being established. So some of the important messages then for cases and contacts. So people who have symptoms, once people develop symptoms and, a GP decides or a doctor decides, look, they are consistent, or this potentially is COVID and you need a test, those people need to self-isolate and their household contacts to restrict their movements. Obviously, once they know they're positive, they kind of this needs to be reiterated about the need to self-isolate and giving advice around that. Household contacts, as I mentioned, of those awaiting result, to restrict their movements. For those other than household contacts who think they may be close contacts, advise them that the HSE will be in touch to give advice and to organise testing. And again, following up on the the case text messaging, we are going to be introducing in the next week text messaging for close contacts, again to get them the information as soon as we have it. And again, just keep reiterating the public health messages. And just the final thing, what if your patient hasn't heard from the contact tracing team? If they haven't received the test result, they can request it from their GP, and GPs do have access to a HSE email address for results. Again, they can also, patients can call HSE Live, and if they haven't heard from the contact tracing team, they can call HSE Live at 1850 24 1850. So that's everything, and happy to take any questions if time permits.